Good day, ma'am, and to each and everyone. So my name is Eliza Crisoc Ferris from BSN 1A of Iloilo Doctors College. And for today, I'm going to perform a demonstration in regards of assessing the neurological system. So prior to performing this procedure, we need to, of course, perform hand washing or hand hygiene. And we need to, of course, prepare all the equipments needed for the assessment. So I have here the equipments needed for the assessment. So the next thing that we're going to do is to proceed with the assessment proper. Hi there, ma'am. Good day. How are you doing?
I'm fine.
Okay, that's great to hear. So by the way, my name is Eliza Crisoc Ferris and I'm your student nurse for today. Can you kindly confirm to me your name as well as your date of birth?
I'm eductional. I was born December 16, 1998.
Okay, thank you. I think we're good in here. So what would you like me to call you, ma'am? Is it by your first name or your last name?
My first name.
Okay, thank you for that, ma'am Ada. So the first thing that we're going to do is to identify our patient. So this is to ensure that we have the right patient. And it is also important to establish rapport as well as introduce ourselves towards our patients. So if there's any curtains or doors within the area, we need to close them in order for us to provide privacy. So the next thing we're going to do is to position our patient in a comfortable position, and then we are going to explain the procedure. Okay? Are you in your comfortable position right now, ma'am?
Yes.
Okay. So, Ma'am Ada, I'm here to perform the assessment of your neurological system. So, why do you have to do this? So, this is to ensure that everything is normal. It's like I'm going to do the test on your cerebral, coordination, sensory, as well as your reflex test. So, if there's any abnormalities, we need to take note of them in order for us to prevent further complications. So do you have any questions with that or any clarifications?
No, ma'am.
Okay, thank you for that. So if you do have any questions all throughout the assessment, you do have the freedom to do so, okay?
Okay.
Okay, thank you. So the next thing that we're going to do is to proceed with the next procedure. So we are going to check here and determine for the level of consciousness. So here I'm going to ask my patient and her name as well as the age and the location of where she is right now. Okay, Ma'am Ada, can you please state your name, age, as well as the location of where you are right now?
I'm Eductional. I'm 22 years old.
Okay, thank you for that. So the level of consciousness of my patient is she is awake, alert, and oriented, which is good. So the abnormal indication for that, of course, if the patient is unoriented. So we need to take note of that. So the next thing we're going to perform is for the GCS. So what is the meaning of GCS? GCS is the Glasgow Coma Scale. So we are going to ask here, we are going to test for the eye-opening response, verbal response, as well as the motor response. Okay, Ma'am Ada, can you please open your eyes and then close? Open, close. Okay, open. Thank you. So, next thing we're going to check here is to ask my patient to tell the name, her name as well as her age. Can you please tell me your name as well as your age, Ma'am Ada?
I'm Eductional. I'm 23 years old.
Okay, good. So, can you do this? Can you please shake your hands? All right, good. Thank you. So, in terms of the eye-opening response, the eyes are spontaneously respond. And for the verbal response, she performed it oriented verbally. And for the motor response, she obeys the command, which is good. And the normal indication for this if there is no response at all. So the next thing that we're going to do is to check and determine for the papillary reaction as well as its size. So I'm going to use my pen light to check if the pupil constrict or dilate as I apply the light. Okay, Ma'am Ada, I'm going to check your pupil here. So you're going to look straight ahead. Okay. Alright, good. So the pupil constrict, which is good. And the size of her pupil is at least 6 millimeters, which is good. So the next thing that we're going to do is to check and graded bilateral hand grasp strength. So I'm going to ask my patient to do some test. Okay, Ada, can you please do this? Okay, so I'm going to apply force as you're going to push it up. Okay. So next, thank you. Next is you're going to put your arms just like this. So here I'm going to check for the force of your biceps. Okay, you're going to push towards yourself. Okay, so I'm going to push it. Okay, good. So you're going to put your hands like this. So here we are going to check for the tricep strength. So I'm going to push it down. So you're going to pull it up. Okay. Very good. So I'm going to ask you to please put your wrist upward, just like this. So I'm going to try to pull it down. So you're going to apply force against me. Okay. Downward. Very good. So Mama, can you please open your fingers like this? So I'm going to try to close it. So you're going to apply force to touch the strength. Okay, good. So next is I'm going to ask you, Mama, to grasp my finger. The other side. Okay, good. Alright. So far, my patient's strength is good. So we need to take note, of course, if there's any abnormalities. So the next thing that we're going to do is to check for the Romberg's test. So, Ma'am Ada, can you please stand? Okay. So you're going to open your eyes and hands at the side. Okay, so I'm going to observe if there is an imbalance or abnormal swaying. Alright, good. So you're going to do this, ma'am. And then close your eyes. So we are going to observe the same thing if there is an imbalance or abnormal swaying. Okay. Thank you for that, ma'am. You may open your eyes and you may take a seat. Okay. So far, there are no swaying. There are no imbalance as well, which is good. So the next thing that we're going to do is for this referral testing. So I'm going to assess for the nystagmus. Okay. Ma'am Ada, can you please follow my index finger as I'm going to move it in a different direction, okay? Okay, good. So far, there are no indication of nystagmus, which is good. Next is we are going to assess for the speech. So I'm going to ask my patient to follow what I'm going to say. So, Ma'am Ada, can you please follow what I'm going to say, okay? Can you say British Constitution?
British Constitution.
How about baby hippopotamus?
Baby hippopotamus.
Okay. Okay, so far there are no abnormalities or stuttering that is being occurred, which is good. Next is we're going to assess for the gait. So here I'm going to ask my patient to stand. Can you please stand? And then try to walk forwards. And then backwards. Again, forward. Then backwards. Okay, thank you for that, ma'am. Can you please take a seat? So far, the walk of my patient is good. There are arm swaying and the posture is good as well. So the next thing that we're going to do is to test for the coordination test. So here I'm going to do the finger nose test. So Ma'am Ada, can you please put your index finger on the tip of your nose and then you're going to touch my index finger. Okay, so we are going to repeat it on again and again as I'm going to move it in a different direction, okay? Okay, good. So I'm going to ask you as well to put your fingers like your index finger on the tip of your nose, and then move your arms on the sideward. And close your eyes. Okay, so thank you. So you're going to do it on the opposite side. Okay, thank you. So there are no abnormalities, there are no stuttering, there are no imbalances as well. The next thing that we're going to ask for the coordination test is I'm going to ask my patient to do a lapping, alternating her hands back and forth. So, Ma'am, can you please do lapping, alternating your hands back and forth, okay? Do as faster as you can. Okay, how about slowly? Okay, good. So next I'm going to ask you, Ma'am Ada, to please do this pinching sensation. So I'm going to ask you to do it on a faster motion. How about slowly? Okay, on the other side, please. Faster. How about slower? Alright. Okay, thank you for that, Ma'am Ada. So for the coordination test is good. So we are going to proceed then with the sensory test. So for the sensory test, we are going to test for the light touch sensation. Of course, we'll be needing a cotton ball here to check for the light touch sensation. Okay, Ma'am Ada, can you please close your eyes, and you are going to tell me if you feel the light sensation, okay? If you feel the cotton ball. Close your eyes. Can you feel it?
Yes.
How about this? Can you feel this?
Yes.
Okay, thank you for that, Ma'am Ada. So, the light touch sensation is good. So next is we're going to test for the pain sensation. So my patient will going to tell me if she can feel dullness or sharpness. Okay, Ma'am Ada, so I'm going to ask you if you feel the dullness or sharpness as I apply the pin on your hands, and then you are going to close your eyes, okay? Okay, can you please close your eyes?
If it's sharp.
Okay, thank you. How about this one?
It's dull.
Okay, thank you. Ma'am Ada, you can open your eyes. Another test for the sensory, of course, is we have the finger. We are going to ask my patient to close her eyes, and then I'm going to move her fingers on a different direction, and she will going to tell me on what is that direction. Okay, Ma'am Ada, can you please close your eyes, and you're going to tell me if what direction I'll be moving your fingers. Okay, can you please tell me what direction is this?
Upward. Downward. On the left. Right side.
Another one.
Upward. Downward.
Okay, thank you. You can open your eyes. Okay, thank you for that. So the next thing that we're going to do is to do with the superficial reflex. So since it will be needing a reflex hammer, so I'm going to recite it. What is the indication for the testing of the superficial reflex? So first is we are going to test for the bicep reflex. So of course the normal indication is the elbow flexes, muscle contracts as well. It ranges +1 to +3. So for the patellar reflex test, so the knee should be extended and the muscle contracts as well, and it ranges +1 to +3. And for the test of the Achilles reflex, so it should be has a normal plantar flexion, and it ranges +1 to +3. That is the normal indication. Of course, the abnormal indication if the range is above +3 or below +1. So the next thing that we're going to do is to do with another neurological test. So we have here the corneal reflex. So I'm going to ask my patient. Okay, so here we'll be needing a cotton ball. So I'm going to ask my patient to look on the side as I'm going to apply the cotton ball on her eyes. Okay, so as you can see, she performed a blinking sensation, which is good. So the abnormal indication, of course, if there is no blinking or there is a rapid blinking after we apply the cotton ball. So we are going to dispose this. So we are done assessing for the neurological system. So thank you, Ma'am Ada. We are done now assessing your neurological system.
Thank you.
Okay, you're welcome. So after that, we are going to perform hand washing. Position our patient on the comfortable position, and then we are going to document all the findings. Thank you.